Everyone, Damon from Dark Raven Training Group. I'm gonna kind of cover my pack today. One of my loadouts. Get a lot of requests when I conduct training, and I got students coming up saying, "Hey, before the course is done, will you kind of walk me through your pack, show me what's going on?" Most of you guys have been to our training events or ones that I've helped orchestrate. You know that we usually run wire to wire, and there's very little, if any, time to do anything like this. So I'm going to go ahead and just cover a video. Not going to declare this to be the best way to create a loadout. Just my way, the way that I've been doing it, the way that I find works for me. This particular ruck, this is the M9 TAC Ops Assault Pack. Very low profile, very slender. This is my, I work on an urban SWAT team. Very heavy, rich ALS area where I've got fire trucks that I could have 10 fire trucks in 10 minutes if I needed it. So I don't need to carry the world with me if I'm acting in that capacity. Now, if I was, say, attached to a unit doing like a narcotic, grow interdiction somewhere in a rural area where I'm going out for a couple of days, obviously this isn't going to be enough. So what I like about this pack most, when I first got on the SWAT team, we had a huge, I think we were using the Rush 72 pack by 511 for a while. I mean, just these huge packs. We carry all these liters of IV fluid and splints and all kinds of happy horse shit. And I think as medics, we became the most annoying guys on the team because as we were trying to clear through structures, I had this huge tick on my back. It made me a problem with the guys rolling through the stack and trying to get where they needed to be as we were clearing. So that's why I liked this. All the guys on my team, we went to this. Granted, you still have a little bit hanging off your back, but not the giant, like I'm hiking through the Grand Canyon for a couple of days. So, all right, real quick, a couple of elements on this pack. Before I get into the nitty-gritty of everything that I have loaded in, how I've kitted it, I've got a pouch here on the outside. This pouch I'm usually in quite a bit. Inside here I've got just some basic 4x4s, some Neosporin, basic bandages. I've got in here some sanitary wipes, alcohol preps, just little things like that. I got some gloves, medical gloves. Got my little pulse oximeter in here. I got some Coban, I've got tape, I've got just little odds and ends things, hey, I cut my finger, hey, I did this, and I've also got some medications in here, like ibuprofen, some Tylenol, some Pepto, things of that nature where, one of my teammates upset stomach, hey, I have a headache, dude, or whatnot. And, I also have some rosary beads. These were given to me by a good friend in the Midwest. So I'm not Catholic, but I'm not a hater either. I need all the help I can get and to keep me safe. So that's inside there. I got a Sharpie. Sharpie's an invaluable tool for any tactical medic. You can write on people, you can write on things, permanent indelible marker. I got some bandage shears kind of hanging up in here. This is all MOLLE. This section where I have this attached, there's a MOLLE section. It's about 1, 2, 3 rows. I got some hemostats in here, just little odds and ends. On the outside of the ruck, I attach my tourniquets. So I usually have 4. I lost one to the back of my truck. I just didn't put it back on yet. But I keep 4 tourniquets affixated on the outside of my ruck. This enables other teammates. The way I look at it, like maybe what's inside here as the medic I'm going to get into, but I want any one of my teammates who isn't the medic just to know, hey, Damon keeps his tourniquets on the outside of the ruck. They could snatch them right off my back. Anybody, I basically leave them out here. They're free to take. If someone's hurt, don't rip me off. So I keep some carabiners here on the outside. These are always a good tool. And then on the bottom here, I've affixed this is just a canvas carry-all litter. I've got 4 handles going down the side, scoop up a guy, and if I get 3 other partners, we can shag him out, get him out of the hot zone, out of the warm zone, and the back of an ambo, wherever we got to take them to evacuate. Another little thing I do here, in the back of this ruck, I've got about 75 feet of webbing. I also have a pre-stitched Class 3 harness. This is actually the guys at Spear Optech created this. It's got a series of loops that I could actually put my casualty into, as such, put their shoulders into, and now I can fix a carabiner or whatever. If I had to pull somebody up through, say, a confined space, through a shaft, or even if I had to get them evacuated up to a helicopter, I can just clip the penetrator here and get the guy, whether he's gorked out or not. It's just a quick, easy, pretty cool device, like I said, given to me from the guys at Spear Optech. And I also have just various sizes of webbing. I'm not going to get into the webbing, that's a whole nother deal, but that's why I keep the carabiners on here. I've got enough equipment here to where if I had to, I could rappel up to 50, 60 feet. I could lower my casualty 50, 60 feet, or lift them out 50, 60 feet. It's not everything a growing boy would want for rescue, but it's enough to get things into action right now if I had to. So webbing, very versatile tool. Okay, so as I go through the ruck, zips down nice and easy. Like I said, it's a well-constructed pack. Oh, I got a little shit show going on here. See everything in the pack, it's not gonna fall out. I can have this unzipped. I could be wearing it on my back. My other medic partners could be procuring items from me. I could hang this up in the back of the armor or wherever I'm at, and I can work right out of the ruck. Now these Velcro patches, or these pouches here at the top, they're made out of Velcro. So it makes the pack modular. Here, basically what I have in the very top one, again, going back to the acronym that we use for treatment, March, M, massive hemorrhaging. So in here I have my hemostatic agents, I've got my quick clots, I've got combat gauze, I've got Celox, I've got a modular bandage from TacMed Solutions, I have different wraps, I have other just plain cotton gauze to overpack wounds. And then the next pouch down, A is for airway. That's where I keep all my airway stuff. I'm a big King LT fan. So what I do is I've got 3 different sizes of King LT that I'm able to keep in here. These King LTs come with a big syringe. What I did is I keep myself just 1 syringe, 3 size King LTs. Took the other syringes out just to save space. I also keep an NG tube to snake down the King LT airway to decompress the stomach. I think that's very important in any patient that you have, whether they're intubated or not, but definitely on a King, I think it's pivotal. If you guys know anything about the King airway, there's debate. They say endotracheal intubation is the gold standard, but if you know anything about these Kings, I don't understand why couldn't I put a King in, drop an NG. I've got this syringe. I can even draw out the NG tube if I had to get stomach contents out, spit them out on the ground. To me, this is the best way to do it. I keep an ET tube set up somewhere outside in the cold zone, but in the hot zone, we're not doing care, but in the warm zone, if I'm in the back of a building and some gunshots just went out and I need to urgently treat somebody, I think that this is good enough. I'm not having to get down with my plate carrier on, try to intubate. Can it happen? Yeah, it can happen. You're a cool guy if you can do it. I'm not trying to be a cool guy. I'm just trying to do things quickly and efficiently. I think this is the best way. Okay, more NG tubes. I got a nice crike kit, very small. If I need to do a surgical crike, this came from TacMed Solutions. And got some spreaders here if I need these to assist with my crike. And then here, on top of here, I've got 3 different ARS, air relief needles for needle decompression. I got a Fox Seal, 2-pack Fox Seal on here for chest injuries. And I also keep a saline bullet pre-filled So, you know, if you guys have seen my tricks before, when I'm decompressing, I like the pre-filled syringe. That way I can lose my skin plug, I can withdraw the plunger out of the syringe, and I can get the positive, I know I've reached into the pleural space once I see the bubbles. So I get a visual, because in our environment, like I said, wearing headgear, there might be a lot of noise going on, not always going to be able to hear the psh. As a matter of fact, I've done it many times and I've never heard the psh. So I opt to go with the saline trick. So moving on down, so basically I have M and then A and R. So I got chest injury and I've got my airway stuff. In the next pouch down, I have some IV start kits. Got some different gauges of needles. Mainly I just stick with 18s. Most anything we're gonna do is gonna require an 18. We're getting out of the business of doing large bore IVs on trauma patients for the sake of resuscitation. Got some saline bullets, Heplocks. I just stick with that. Moving on down, the very bottom pouch, I have a SAM splint, but I'm mainly keeping the SAM splint in there to keep everything safe. Because down in here, I've got my drugs. And I'm not gonna get into everything that I carry. Suppose I could. Don't want anybody coming and ripping off my pack, but I've got all my analgesics inside here. I've got some ketamine. I've got obviously Epi 1 to 1000. I only carry about 7 or 8 drugs on me. Something to help with pain, something to deal with the bug bites. I carry nitrates because I got guys on the team that might develop chest pain, and some syringes and needles to push those drugs. And in the back, I just have, again, a bunch of needles, different size syringes, and whatnot. Oh, and also these guys, I'm a big fan of nasal drugs where I can do it. So I've got an adapter here. So if I needed to give a guy a large dose of ketamine, I would just opt to go through the nose if I hadn't already established an IV. So moving on down, that's the main body of the pack. Now we get into the flap. There's 2 different compartments in here. One of these, I keep my EZ-IO. Big fan of the EZ-IO. I would probably opt to IO more guys that I'm going to try to start IVs on in tactical situations. So again, M, A, R, C for circulation, and then my drugs. And then as I roll down the pack, last but certainly not least, I've got H. I keep 2, 3, sometimes, I'll try to keep 4. Right now I got 3 because I used an emergency blanket in a demo. But these blankets are, they're great for trying to prevent body heat loss in the trauma patient. I think it's something that we don't talk about enough. You guys that have been in my class, you've heard it ad nauseum. I'm always saying, you gotta keep your casualty warm. You gotta prevent body heat loss. We lose 1 to 2 degrees of core temp, fucking forget it, write it off. The dude's gonna die. So let's take provisions for that. And then also up here, because it's quick and easy, I've got my basic airways. So NPAs, I've got a few of those. I've got some lubricant. And that pretty much rounds out the pack. I've got, you know, a place for accessories and whatnot. I'm not really sure what to do with this. I keep some hemostats. I've got another ARS needle. I put some tape here around the cord so I can just roll it out, Coban or tape. Like I said, I'm not trying to, again, my pack is built for an urban team. Oh, and then also, one other thing I'm snaking in here, the very bottom pouch, I've got a single bag of lactated ringers, and I've got an infusion set. I only carry 1 bag of lactated ringers, and yeah, and that's it. And then, yeah, of course, some more webbing. I got webbing crawling out of my ass everywhere I go. This is a very, not just for evacuation, not just for rescue, but there's a lot of uses for webbing in our environment. So, again, if I was, the other thing that I like about this pack, I've got some buddies in the, they're PJs, pararescuemen. This is a pack they like to roll with. I've seen them, a lot of my buddies have frames, hard frames. I'm not real big on the hard frame because I'm not walking very long. I'm usually just walking, you know, how I'm exiting an armored vehicle, going into a building. I'm not out in the field for days on end. But the other nice thing about this pack that some of these guys will do is they will purchase additional pouches. So, for instance, if I'm a ranger medic, let's say, if we're going out to do an assault, I'm probably loaded out similar to how I am here. But now if we're gonna go out and let's say, you know, dudes on the team are jumping for the day and I wanna create a pack to support that, well, if I have different pouches, I could load it out with different stuff. And maybe in that environment, I wanna bring more splints, maybe some ice packs, right? Because I'm thinking more ortho injuries. That's what I like about this pack is, like I said, you get more of these inserts. You can modulate them, you can build it out however you want in just mere seconds. Just rip out these pouches, put new pouches in, close it up, zip it up, throw it in the back of your truck, and get going where you need to be. So, anyhow, that's my ruck in a nutshell, and I hope you guys enjoy the video. Take it easy.